My name's Kelly, and I'd just like to welcome you to our virtual presentation. We're going to be discussing managing triggers during the holidays. There is an interactive poll in the chat. It's anonymous. If you don't care to join in that, if you would like, it's asking if you're a person in recovery or you're here to learn about supporting a person in recovery. Just take a minute and do that. I'm one of the hosts and the presenters for today, and that we hope in the next hour you can take away a handful of valuable information. And also, if you want to put your name and your organization in the chat, just so we know who's with us, that would be great too. And then if you want to use speaker view at the top right of your screen instead of the gallery view, that would be good too. And you can always use the chat for any questions. At the end, we're going to have a question and answer. So we'll take some time for that. And then one more thing is we are live on social media. So I just wanted to let everyone know that. Yeah. So like I said before, my name is Kelly Ochberger. So I'm the lead peer recovery supporter at BrightView Health. I work out of the Coleraine office, and I've been here for about 3.5 years. Rhonda, you want to introduce yourself?
Sure, thanks, Kelly. My name's Rhonda Roper. I'm a LCSW, a licensed clinical social worker in Kentucky and Ohio, and I'm the Vice President of Clinical Services. So I work with all of our Kentucky sites and working with all our great clinical teams and just implementing our care for our patients. So great to be here with you today.
Thanks, Rhonda. So we're looking forward to having this discussion about helping our clients, patients, and family and loved ones stay sober throughout the holiday season. So we're going to cover managing triggers, utilizing specific coping skills, addressing feelings of isolation, grief, and all of the emotions that come along with that for the holiday season. And we're going to encourage boundary setting. And then at the end, we're going to have a question and answer session. So that's the agenda for today. All right.
Welcome everyone. I'll go ahead and get started today. And so let's talk about the holidays. And so certainly we're in the midst of holidays. We have Christmas coming next week, believe it or not, and then we'll certainly have New Year's Eve and New Year's Day afterwards. And so this is a great topic for us to be talking about. And then most importantly, just to help talk through some things that could be really beneficial for individuals who are in recovery, or if you're an individual working with other individuals in recovery, or as we know, you may even have a family member or a friend or someone in your close circle with a substance use disorder. So let's talk first and foremost just about how alcohol use can be really normalized during the holidays. So that certainly can make the holidays more challenging. Oftentimes there are alcohol, maybe even other drugs at parties or get-togethers, and so that can certainly cause added stress for individuals in recovery. So we're going to talk today about some, again, ways to work through some of those things and how to be equipped to handle that if it does happen. And then also how to help you assist a person in your life with that if it does happen to them as well. Additionally, the holidays can certainly be a time of parties and get-togethers. And so there can certainly be some substance use in those parties, but let's be honest, just the act of being around so many other people, or maybe even people from our past, can certainly add stress for the holidays. So again, we're going to talk through some of that today. As well as just that financial pressure that can come during the holidays. There's certainly a lot of focus on gift giving, traveling, going to events. And so just that stress alone can be an added trigger for individuals from any background. And then also, of course, additional stress for those in recovery. The hectic pace of the holidays can, again, just lead to, extra stress and triggers. It can also, lead us to stop doing some of those things that have been really effective for us or effective for people, in recovery. So those routines that work day to day can sometimes fall apart during the holidays. Things that you normally are doing, like eating right or exercising, those things can sometimes get interrupted. And so, again, that sort of sets you up perhaps for an unhealthy path, or again, you lose some of your skills and strategies that you've normally found helpful for dealing with stress or things that may occur. There's that frustration as well, that can occur during the holidays with just being able to live up to the expectations, to be able to meet those responsibilities. And let's be honest, the holidays are certainly a time for joy and celebration, but some of the just things that we've added into our routines, into our expectations, can again certainly set us up for added stress and sort of feeling like there's this need to perfect the holidays, as far as that goes. Just right along with that, those emotions can really peek into our lives. We can start learning that we're having memories of things from our past, maybe hurtful memories, or perhaps we've lost someone during the holidays. I was just thinking about, seeing commercials on TV for holiday activities or events, or just commercials of get-togethers. And you typically will see these large families, sitting around the table. And so if you're an individual and you don't have a large support system or a large family, these things can sort of trigger some loneliness, some grief, maybe even guilt. And of course, anxiety and stress, we've talked through a little bit already, but just what we just mentioned can certainly be, a trigger for anxiety, but it could also, be an anxious situation just to start thinking about the holidays and what that's going to look like, what those events that folks are going to, how those are going to play out. And so we're going to talk through some of that today. And then lastly, one other area that can really be a trigger is just the fact, again, of skipping those things that normally are really helpful. Again, it's a very busy time of year. And so if an individual in recovery has traditionally been going to counseling or therapy, they've been going to self-help meetings like Alcoholics Anonymous or Narcotics Anonymous, Celebrate Recovery. Sometimes some of those things may fall to the wayside. Individuals may feel like they're too busy to go. And so missing those therapies or appointments can certainly add extra stress and again be a trigger. One of the other things we always want to just give some recognition to, during this time of year is just how normalized substance use can be. I'm going back to those commercials I was mentioning a moment ago, but how many commercials do you see in an afternoon or evening of looking at the TV that really again involve a family sitting around the table, everyone drinking, and so for individuals in recovery, that can certainly lead to some uncertainty, some stressfulness, and then again, certainly be a trigger as well. And as we know, alcohol use is, certainly normalized in our society, and it's again a globally accepted and legal substance to consume. And so that alone means that it's very accessible, it's very available. And so if an individual is dealing with that, again, that can make things difficult. And so having some plans to help with that are really important. As far as alcohol goes, there are 1 in 20 deaths worldwide as a result of alcohol. So even though alcohol is so normalized and commonly used, it certainly can have negative impacts in people's lives, especially those with recovery, and certainly lead to just as many deaths as well. In thinking about being around family, alcohol again is probably the most common, but it may be that if you're an individual in recovery, or it may be that individuals in the family are using substances during holiday events, or it may be that they're using substances, they have a substance use problem, and so getting around them at the holidays can certainly put an individual in recovery at an increased risk. Marijuana use, again, another substance that's again very normalized, getting more normalized across our world, just based on legalizations and things. And so certainly that means it can be more accessible and available, and definitely be another substance that could lead to triggers for individuals. So really important to consider those things for folks that you're dealing with that are in recovery or maybe trying to start recovery themselves. So we want to talk now about just, we've talked about that normalization of substances, how the holidays can be a more stressful time. And so one of the things we want to spend a good portion of this presentation on today is just helping equip individuals, helping equip you as a supporter of someone in recovery, and just knowing a little bit about what to do. And so the first thing that we want to talk about is just recognizing those risks, acknowledging that the holidays can be a stressful time, acknowledging that individuals, may be present who are in recovery or they're trying to make lifestyle changes. And so when we're talking to individuals in recovery, we want to make sure that they know, who they might be, running into at events or in their family that could be a trigger. Identifying those triggers ahead of time are really important to sort of know what you're walking into, know the atmosphere, know what might be happening there. Many of our patients, as we talk with them in our program, the holidays can be a time when they know there are folks in their family who are using. And so typically some of the support we'll give that Kelly will talk with you about a little later is just, it may be necessary to avoid some of those contacts with those folks if they are using substances. So again, helping them be equipped to know what they're walking into. And then we'll talk a little later about boundaries and how to get those in place, and then developing that plan for success. So this slide here really has a good overview of just how to get that plan together. And so we've talked a little bit about identifying what you might be walking into, but then also preparing yourself. And so one thing that we like to utilize to help in being prepared, there's an acronym called HALT. And so you'll see that on the slide there. You want to walk into a situation and make sure that you're prepared and that you're in the best state that you can be in. And so that H in HALT stands for hungry. And so going into a holiday event, to a party, going around your family, we would recommend that you not go into that situation hungry. Let's be honest, right? When we're hungry, we tend to be a little more irritable. We tend to be quick to move through things. Decision making can be challenged. And so walking in, having had a meal or a snack really sets you up, to make better decisions, feel more stable and secure. That A in HALT stands for angry. And so making sure that you're not walking into a situation angry or upset at something, harboring a resentment or an issue that could certainly, again, lead you to maybe not make the best decisions or cause added stress or pressure in getting through a situation. That L in HALT stands for lonely. So making sure that you're not lonely and sort of just walking into an event, just, looking for someone to interact with, really hungry for attention or hungry because you're lonely and just really needing some social connection. When those things happen, it can be easy to get caught up in maybe a relationship or a social exchange that are not that helpful. So again, not going in, to a state feeling very lonely or angry or hungry. Those are three things that are very helpful. Lastly, in that acronym, that T stands for tired. And so if you walk into a situation, you've not had a good night's sleep, you're not rested, you're probably, again, going to be a little vulnerable, right? You're not going to be able to as easily stick to that plan that you made prior to the event. You may be easily triggered. And so again, going in prepared, identifying what you might walk into. One of the things that Kelly will share some great examples on at the end of this presentation is just how volunteering can be so helpful during these events. And so if you know that you're going to a family affair, it's probably a good thing to walk into that situation and have a plan of what you're going to do. That plan may look like you just volunteer to help with serving the food. You may walk in and say, I want to be the one to help with cleanup. I'll help with these chores or these activities, just so you are there, you're able to be committed to something, you have a good structure and a good plan. Shifting focus is also a helpful part of just being able to work through these situations. And so we've talked a lot about alcohol so far. And so if you know you're walking into a party or a family gathering, and I've heard patients say that they know that their brother may offer them a drink. And so some of the feedback we've set up is walking into that party with a drink in hand, bring a bottle in with something, tea or, a non-alcoholic beverage. So you don't feel tempted to put something in your hand, just like everyone else that's there at that event. Playing the tape and looking through at that situation and how it might work out, either for the good or for the bad, is really important. Playing the tape really just means thinking about what could happen if certain events play out a certain way. So that situation I just shared with you about someone's brother offering them a drink, them being in recovery and not wanting the drink, it's really helpful to think about what it could look like if that person did have the drink. What would that look like? How would that impact their goals? How would that impact their recovery? Is that worth doing? On the flip, thinking about if I walk into that situation, I have a drink in hand, I avoid any alcohol. Man, if I can get through that event and do that, I'll feel really strong and proud in my recovery. And so again, playing that tape out and looking at both things that could happen on both ends of the spectrum are really important. Being prepared is also really crucial here. So again, we've talked a lot about being prepared, but we'd even take it a step further and say, be prepared around what time are you going to arrive at this event or this situation? How long are you going to stay? And even setting up some red flags on, okay, if these things happen, then I know it's going to be time for me to leave. And almost preparing a script of what you'll say if that happens. It may be, I've got some things going on tomorrow. I'm not able to stay much longer. It's been great to be here. Thank you so much for having me. Again, being prepared and setting up a plan. And then we'll spend some time on this last one. I think this is so important for any individual during the holidays. Just letting go and letting go of false expectations. Again, I'll take you back to those commercials I've been seeing for the last couple of weeks. You look at those commercials, you see everyone, sitting around the tree, around the table, these large families, everything, certainly looks great. Everyone is happy and jolly. And while we know that that is the case sometimes, we also know that, everyone's human and people from different backgrounds and different experiences are around in every family. And we know that most days don't go perfectly. So letting go of those false expectations and again, just being prepared and having a plan. A little further on just family and relationships. It's no secret that family and relationships can certainly be, an added stressor. And then on the flip, family can be such an important part of a recovery process and a support process. And so, we would recommend just being prepared again. When you're going to see your family, they may ask you about your recovery. Being prepared to know, what you're going to say. You don't have to share your whole story. It's okay to come up with a snippet of what you want to share if you want to share that at all. So walking in prepared of what part of your journey that you want to share, again, is pretty crucial as a part of this process to help with the support during this time of year. Setting boundaries, again, is pretty crucial. We'll talk on that in a little more detail in just a few minutes, but, just letting loved ones know how long, again, you're planning on staying and sticking to your plan. Sometimes when we get in social situations, it can be easy to walk in and have a plan and then feel tempted, to please others, right? We don't want to be the one in the crowd that's not, fun and jolly, or the one that leaves early. But setting those boundaries and making that plan ahead of time, we've seen that be very successful for individuals. If you're someone with a family member in recovery and they, leave the event early or leave the family celebration early, we would encourage you not to make a big deal about that. They are doing what they need to do for them, and that was probably a part of their plan in just coming in and being their best self during that event. We talked about going in, to a gathering or celebration and offering to help out. And so again, I think for any of us, when we get around family, sometimes bringing up memories from the past or past situations can be stressful. And so helping out with just the whole process of the meal, the activity, helping out, with chores, those things can be really, really helpful to everyone in the family. And then also really help give some structure to the day, just so you're not in a situation that could potentially lead to more stress or anxiety. Recognizing differences, so important. When any family gets together, and folks are around the table or in the house, or any event, even if it's a work event, we know people come from different walks of life. And even if a person is in recovery and they're very successful with that, there may be folks, in the family that don't understand what that means. They may, have some resentments for something, or there may be some past issues that surface again. And so it's really important to just recognize the differences. And we would encourage, our patients or any individuals in recovery to just walk into a situation with realistic expectations, understanding that everyone may not get it. They may not understand why you're sober at the holiday event. They may not understand why you don't want to have a drink when they've never known you to have a problem with alcohol. But if you're in recovery, sometimes individuals won't use any substances, and so alcohol included. And so just understanding that not everyone is going to get that really helps with just walking in with probably realistic expectations. And then lastly, we would say just treating yourself after a holiday situation or a gathering. You've spent that time putting that plan together, and being able to follow that plan takes a lot of work for anyone. And so once you get through that holiday event and it's over, looking back and at the gains that you made, how did you stick to your plan? Maybe your plan wasn't the best plan, and next year you think, gosh, I'm going to do things a little bit differently. So and then lastly, really practicing gratitude and rewarding oneself just for getting through that situation and sticking to their plan. Rewarding yourself could look like many things. For some, it may be ice cream, maybe baking something, a bubble bath, a video game, a movie, any of those things that are healthy ways to just celebrate yourself. We've talked a bit about, the stress and anxiety that can occur during the holidays. And, on the flip, it certainly can be a joyous time for individuals as well. And then we also know that even if it is a joyous time, it can also be a time of some mixed emotions for many. Even, individuals not in recovery or individuals without a substance use disorder, for anyone who has ever lost someone during the holidays remind us of that person that we lost. Even if we lost them in a different part of the year, it's not uncommon to long for them or miss them during the holidays. So just being mindful of that. Other people at events or in your family may be dealing with grief or loss. And then for folks in recovery or individuals in recovery, grief and loss can really be escalated during the holidays. And again, that can be difficult and challenging to deal with. And so acknowledging that those losses have occurred and, being able to be open with that with people in the support system is really a key to working with that. Healthy relationships, could be severed during the holidays or in the past, and the holidays are a reminder of that. Maybe an individual has had to limit their contact with their father or their mother, and then they know they're going to see them at a holiday event. And so, even if you walk into that situation with a plan and you feel confident, just having to deal with that alone, right, can be an added stressor. And certainly can lead to some feelings of grief or loss. Again, I'll take you back to those commercials I've been seeing. I think we all want to have the best of interactions with everyone in our family during the holidays, and that norm is really for everyone to unite and celebrate. So again, just understanding that it could go either way as far as that goes. Continuing to kind of look at both sides of things and how they could happen, managing expectations, and really, that comparison piece I just mentioned about those commercials, just the same as those commercials, right? If we get on social media, there's a lot of advertisements for holidays. If you get on Facebook or Instagram or any of the other social medias now or anytime close to the holidays, it's not uncommon to see people posting pictures of all the activities they're engaged in for the holidays, all of the family events that they're doing. And so that can certainly lead to some comparison and again, isolation and grief if that's not what's happening in your own life. And lastly, I would share, being around people that you've not been around in a while can be challenging. And so if you're going into someone's home, that sort of puts you on their turf. And so we like to recommend for our patients to meet a family member out or a friend if they're reuniting with them for the holidays. Meet them out on a neutral turf. By neutral turf, I mean, a coffee shop or a restaurant, somewhere where it's not their home. You are able to feel, like it's a neutral spot. And we tend to see people, have a little more confidence when that neutral territory is there. I've certainly talked a lot about some of the negatives that can happen, with the holidays and the stress, but looking at any of these situations, it's important, to practice gratitude. Think about the gains that you've made in your life or in your recovery, and really patting yourself on the back for going into these situations, having the confidence to go to these holiday events and interact with people from your past. It can be very difficult, and certainly even more if you're in recovery. So we encourage use of gratitude and just again patting yourself on the back for what you've accomplished and all the gains that you've made. Coping skills, often come up in our work with our patients, and coping skills are really important, around the holidays for any person. And so we again like to talk through the coping skills and would recommend, having a plan, having some coping skills that are, at your disposal that you can go to. Just if you feel stressed, if you start to have, unpleasant emotions or something out of the norm happens. And so going back again to just being prepared for the situation, remembering why, thinking about, why you're doing what you're doing. If an individual is in recovery, thinking about the reason, thinking about their long-term goals, thinking about where you want to be next week, how things will look like on the short term. Thinking about those what ifs when you walk into those situations. I've talked a few times today about playing out that script, sort of looking at how it could go well, how it may not go well. And so we really encourage, using some mock conversations to prepare for that. So if you've got a family member who is going to ask you a lot of questions about your recovery, or maybe they're going to bring up a lot of stories about your past when you were using, going into that with sort of a script and practicing that with somebody in your support system can be really helpful in just being prepared, and sort of having that plan and preparing for the worst. And then, of course, having that escape plan. if you're talking with your uncle and he just continues to bring up things that are causing stress, then it's okay to just have that plan and say, gosh, it's been great to be here, but I got to head out. I've got somewhere to be. Recognizing those risks, in those situations. I've talked a little bit about, some of the family members you may run into, and it may be a person, maybe a place, maybe a thing, It may be that going back to a town where an individual was really in heavy substance use, could really be a trigger for them. And so those are, again, things, we commonly will work through with our patients and again, help them have a plan. Know that environment, know what to expect, and just, honestly, what are you going to be walking into? Chances are some of the things are probably still present that were present in the past. And so, again, having that plan on both ends of that, preparing for the worst and then preparing for the best. Playing that tape again is so crucial, and really working through, that euphoric recall. And so it may be that we've had a negative experience with Grandpa every time we've gone to Grandpa's house, but as humans, we tend to have that euphoric recall to think about, gosh, it may be like that one time when Grandpa was really great. And so we may really, hitch to that wagon that Grandpa is going to be, different this time. And, things are not going to go negatively again, but, and hopefully it doesn't, right? But still thinking about both sides of that and what could happen is really important. So being prepared there is crucial. Modeling, the scene and what could happen. We talked about that a moment ago, going through those scenarios in your head of what could happen. I would encourage you, if you're a family member of someone in recovery, you even thinking through those possible scenarios, think about, offering, alcohol, and think about, how you might, if everyone else at the table is drinking and you think that person may not, think about how you approach them and ask them that, and how you make that a comfortable situation for them. Find someone in your support system, if you're an individual in recovery, that you can work through these things with, and kind of role play. Role playing is so important. I think, anytime we have someone else kind of act out something with us or talk it out, they sort of add another level of complexity to it that really helps us to be able to think things through and sort of have those, potential what ifs. Having that preparation for how you're going to answer questions. I know in working with a lot of patients in the past, some of them have come to me and said, gosh, I'm really surprised at how many people were asking me questions about my recovery. It made me really uncomfortable. And so we would encourage individuals to have a plan for how you'll respond to that. If you don't want to answer those questions, just redirect and say, hey, I'm really, moving forward and I really want to talk about something else. That's okay to do. Brainstorming, other answers or possibilities of things that could come up, how you might respond to them. Maybe on the flip, you're really expecting a lot of praise from someone in your family, and you might get a little uncomfortable. Sometimes we do when individuals are offering praise. So again, having that, rehearsed kind of response that you're going to follow will be really helpful. And then lastly, being accountable and taking ownership for the outcome. I always encourage patients, you're going into that event, you have control over how long you're going to be there. You stay as long as it's enjoyable for you, as long as it's comfortable for you, and then congratulate yourself, once you get through that situation or that event. We talked a bit about boundaries, and so we'll look at those in a little more detail. Boundaries can be really helpful, and so boundaries can be a vague term if you're not familiar with the meaning. So I'll start by saying, boundaries are basically a way that we set limits so we're able to stay in our best place or at our healthiest level. And so We encourage, use of physical boundaries. When you're interacting with family or maybe, a past person that you've been in a relationship with, you're going to run into them. So you want to walk into those situations, with your physical boundaries prepared. How much touch are you comfortable with? How much personal space do you need? When will too many people, be too many people? Gosh, if there's more than 6 people at this event, it's going to be too much for me. It's going to be difficult. So I'm going to have my plan to exit. Just the same as that physical, boundary in that regard, you also want to make sure that, you walk into that situation knowing, when you're tired, when you've had enough time, when you've kind of reached your limit. That too would be that physical boundary. Mental boundaries are going to be, your thoughts and ideas and just how you're able to manage those things, during these events or situations. It may be that you're finding that you're talking about things and you're not really getting the best reception from some of your family. And maybe you set up this limit to say, hey, if they start, questioning me or if they start, being negative to me, then I'm just going to tolerate that for a few minutes and then I'm going to, again, have another plan to exit. That emotional boundary is also a really important piece of this. Just walking into a situation or an event, knowing, what you're willing to share. We've talked about that a little bit today. But also just knowing what you're going to do if a response doesn't go the way that you want it to with someone. And then also knowing when you've kind of reached your emotional limit. Sometimes when we get in large crowds, it can be easy to feel drained after a certain period. So we encourage patients or individuals to really kind of set that up and know sort of what that time frame looks like, know some of those emotional triggers that they'll start feeling to let them know, hey, I think it's time for me to maybe start, exiting and having a strategy to leave. Lastly, self-talk is so important, in working through any of these situations. And so walking into an event or a holiday festivity and really, walking in with the idea that you're really there because you want to be there and you're not there to meet unreasonable expectations of other people. Maybe you as an individual in recovery, you've made great progress in the last 6 months and they're really focused on, talking about all the 6 months prior. And so again, knowing what your limit is there, using self-talk, telling yourself that you have the right to make your needs as important as others. If sitting at that table and watching people drink all afternoon with their meal is triggering for you, then you don't need to be there, right? And you have to be able to set that limit, and that self-talk and reminding yourself about your ability to do that and make those decisions is so important. Having the right to say no, and not feel guilty about it. And then also knowing your right to be treated with respect. And then walking into a situation knowing, again, both sides of that coin, right? All relationships are not going to be positive and perfect. And so being prepared for both of those. And then if your boundaries are in place, either in place for a reason, so walking into that situation prepared and feeling good about the fact, that individual has prepared those boundaries, and again, congratulating themselves for being effective in following through, which can be very difficult. So I know that was a lot of information and strategies just for managing triggers and recognizing triggers. And so I'd like to turn it over to Kelly now. She's going to give us some good real life examples and also some examples of some of her work with patients. So Kelly, I'll hand it over to you.
All right. Thank you, Rhonda. Just listening to all that, was some really good information, and I could really relate to it all, thinking about my own recovery process and early on those first few holidays. My family, I was the black sheep of my family. And so, they didn't really know what to expect out of me each holiday or each family function. I didn't know what my behavior or what state of mind I would be in. And I had a lot of guilt about that in early recovery. I didn't have a lot of money. I was worried about how certain family members might treat me or things different people may say to me. And so I really do think planning is one of the biggest things we can do, because we have to protect our recovery first. That's going to be the most important thing. And so I was able to craft and make baked goods to take, and I was able to, kind of be involved a little bit. I do remember that first or second holiday, kind of staying a little more quiet and sitting back a little bit as I was getting to know myself and as my family was getting to know me and I was getting to know them for the first time in really a long time. So we've been talking about this a lot in group with my patients, and just what are we going to do and what are their plans going to be and what are their circumstances. And I have one person that a lot of her family members use, and she has decided not to go at all for the holidays, which is totally fine. She's going to avoid that this year to keep herself safe, and that's what's best for her, and that's okay to do. I have another patient that used with a cousin of his. And so, going over there, for the holidays, they would go outside or leave for a little bit and use. And he was a little worried about that. And we've talked to him about talking to his mom to tell her kind of what's going on in the situation, so he can have some support there and have somebody to kind of be watchful of that, just to kind of hold him accountable. Another thing we've talked about is kind of having a support person on call. So talking to somebody that supports you in your recovery and saying, hey, I'm going to be going to my family's for 2 or 3 hours on Christmas Eve or New Year's Eve. And I'm a little worried about things that might get said or how it might turn out. Would you be able to keep your phone close to you so I could text or call you if I needed some support? I think that's a great idea. But overall, just being prepared and using these tips that Rhonda was teaching us about are great things to do to kind of set the stage to have a successful holiday. And, we've worked hard for our recovery and we want to enjoy it and we want to be a part of our family. And it may take a little time, but I just encourage you to really put yourself out there and do that and try to be a part of things and be a part of the cleanup and enjoying the holidays with your family. So we'll do questions and answers now. So let's see if anybody's got a question to ask. You can put it in the chat. Oh gosh, okay. We've got some that people asked during the registration, so I can use those also. All right, let's go with, what are some suggestions for replacing old holiday habits and how do you encourage people to have a safety plan?
Yeah, I'll start and answer that one, Kelly. Just the flip, right? Those old holiday habits, let's start some new holiday habits. And so, identifying some new things that you're able to do, maybe you have some support group members, from self-help meetings or any organization you're associated with for your treatment or your recovery. And so partnering up with those individuals, going out for a holiday meal. Kelly and I were talking about some things earlier, just looking at holiday lights and activities like that can be so enjoyable. Working with your support network to figure out other opportunities can be really important. And again, just reiterating, out with the old and in with the new, right? Setting up some new activities is so important.
Yeah, I like that. Okay, another one says, what are the best ways to handle seasonal depression and the impact it can have on recovery during the holidays?
Yeah, so seasonal depression can certainly, it can occur, during this time of year with the shortened days, decrease in sun and daylight. And so one of the things that I've seen be really helpful with that is, implementing physical activity. Exercise can be really, really helpful. Again, it doesn't have to be something that's too intense or crazy, just incorporating, daily walks can be really, really helpful. Anything that gets us moving, can really help with releasing endorphins and things to sort of counteract that lack of sunshine. And then also, of course, anything that we can do around getting outside or outdoors, if weather permits, even though the sun isn't out, being able to get out during the day and walk and get that exposure to nature and to that light can be helpful. And there are also some lamps and lights out there that you can actually purchase to help during this time of year. They're pretty inexpensive. I know I've helped individuals get those before. Amazon has them for a good price, but you can have some exposure with those to help kind of supplement the sunlight, which can be really helpful as well.
Yeah, that's good, Rhonda. I was also thinking too, it might be a time to try some new coping skills, that you've heard from other people in recovery or people in your group therapy or whatever, something that they're doing that you haven't tried. Maybe
Yeah.
it's a good time to try that.
Hey, Kelly, I'd add in there also, we've talked a lot today about having a plan and, things. So since we know that the days are shorter, there's less light during, this time of year, having some activities in there, things that you enjoy. Again, it doesn't have to be anything too intense, but, it may be that you enjoy, cooking a meal or baking, some type of games, something that, you like to do in that regard. So, having a plan is certainly really helpful, like you suggested there, Kelly.
Yeah. Okay, another one. Oh, go ahead. No, go ahead.
What about self-awareness? I know a lot of people don't know the word seasonal depression, but self-awareness, if I notice that I'm sleeping more, or if I'm not willing to go outside or to get active in any events, self-awareness is going to be a key. And self-awareness as far as the family members too, I might have some anxiety I'm experiencing before just the thought of going to the Christmas party,
Yeah.
and just that awareness will allow me to be able to speak to somebody in my support group, to let them know that, hey, well, man, I'm a little apprehensive of, about going, to identify some feelings. We need help with that sometimes in recovery.
Yeah, absolutely. Thank you for sharing that, Gilbert. Planning ahead, right? Like we've talked about. And so don't wait until a couple of days before the holiday. Start thinking about that early on. And, if it's October and you're starting to have some nervousness about, the holidays and interacting with family, start talking with people in your support system, at that time about that and, start getting that out. So it's not like harboring inside and escalating. The more we hold it in, right, the more it increases and escalates. So I really appreciate you sharing that. I think that's really important for sure.
Yeah, I actually have something to add to that. When I got out of treatment, I wrote a list of warning signs and gave to my family, just so I had another person that was seeing me on a regular basis that knew, like, hey, if she's sleeping a whole lot and not really interacting and isolating, or if she has quit going to her meetings, those are things to watch out for. And if you notice that she's doing that, you can, present that to her and talk to her about it. That was helpful.
I have a question for you guys. This is Lindsay. I'm one of the comms out in Zanesville. I recently had a patient explain to me that they're having a hard time getting their family to understand the need for recovery. She said that they minimize her habits when she may be talking to her family, saying, "Oh, you're not as bad as the others. You don't necessarily need help." Do you have any advice in how this individual can talk to her family and really explain what she's going through and her needs?
Yeah, I'll start, and I'm sure Kelly, you have some good advice on this as well. But I'd say first and foremost, education is so important. Not everyone understands addiction, not everyone understands recovery. And so, I think us offering that resource to that individual or that patient, so they're prepared to have, just a good script or some good information to share with their family. Again, their family may not want the information, they may not be that receptive, but having that ready and prepared helps them walk into that situation, with a plan. I'd also add in there, if appropriate, right? I'd say that patient would probably benefit from talking to their counselor and, is some family education or family, a family meeting or family session, is that going to be helpful? And then lastly, I'd say, self-help groups, AANA, they all have, family meetings available. So that again may be a potential option. I think I'd, want to know a little bit about that person and their situation, but those are some things that I've seen be helpful on my end. And then Kelly, do you have anything to add in that?
Yeah, I think education is huge and that would be great. But I've also heard about some family members not being interested in that, right? So they say, oh, well, I'm not the one with the problem, so I don't need to know about that, or I don't believe what you're saying. I don't think that's right. Or so, what do you do when a family member isn't willing to get the education or listen to the education? And that can be difficult. And so really, it makes me think about just your recovery kind of shows for itself, right? And so I think just having that open discussion of, look, me going to these meetings 3 times a week and me going to this treatment center and talking to a counselor, it's helping me and I'm doing better. And, that's okay if you don't understand it. This is what I'm dealing with and I do understand it and I'm doing better. I'm feeling better. I'm able to be a better daughter, sister, whoever the family member is, it might have to be good enough.
And I think also
Projecting.
too, if we put ourselves in that family member's shoes, what are they dealing with? The reason they have these feelings or emotions about us, because I know that when I got sick, I made my whole family sick. So they're just as sick as me. So offering empathy and understanding to that family member of why they're feeling that way, because they may be dealing with embarrassment, they may be dealing with anger, and allowing them to vent that and open that up, that opens up another line of what I call togetherness with that family member, more so than pushing that family member away. Oh, you stupid, you don't know what you're talking about. I need my meetings. Offer that empathy to that family member, draw them closer to you. But I got to continue to set the example, because if I fall off, I make them sick all over again.
Well, and I was going to interject if you don't mind. I've had a client who is dealing with not alcohol addiction, but some mental health issues. And she comes from Appalachian, Ohio, and her family does not believe in mental health problems. You deal with that in the family. And so she has really struggled. She's now in her 60s and just now we've got her just to see a psychiatrist. We've got her to get on antidepressant medication. And one of the things that, really kept her stuck and sick was the fact that she felt like she had to make her family understand. It was her place to, get them engaged. And I think sometimes we have to realize, and our clients and the people we're trying to help, we have to let them know that you've got to decide boundaries for yourself. How much of this can you continually ingest before it feeds your sickness and it keeps you sick? So, it's not always about everybody agreeing or approving of what I need for my health. It's about me. If I, for me, I'm a baseball fan, so I always go with 3 strikes, you're out. I'm going to try 3 times. If I don't get anywhere, then I'm just going to accept you for where you're at. And I'm going to continue and decide how I'm going to move forward and set boundaries with you from that point on. And that's safe for me. If you change, then great. We'll reinvent, we'll go back and look at it. But I think that a lot of times in this client I'm talking about in particular, she put a lot of stress on herself, and she's been through the death of her son, the death of 2 husbands, and all because she was trying to fit a mold with her family. And everybody said, you keep this in the family, you got to get family support. Well, sometimes family is not the support, and we can't push our support networks on other people. We have to let them develop those and say it's okay if it's not family. If they don't understand, it's okay. Just my thoughts.
Yeah, I agree with you. I think it's what we've talked about, kind of looking at both sides of the script, right? It may be that all of those things happen and they still don't accept or understand, but there's that piece in knowing, well, you tried, right? You did your part. And, if you're that patient or individual and, you tried to offer that education or that resource or, something to help them. And so, and I think just like, Gilbert mentioned, checking in with them on sort of where some of these things are coming from on their end, and understanding that with empathy also. So, yeah, I think that's great feedback.
David?
Good afternoon. How is everyone? Everybody all right? Can you hear me?
Yeah,
Oh, we can
yep,
hear
we
you.
can hear you.
Good afternoon.
Yeah. How are
Okay.
you?
I am well. I am well. Happy holidays. Progressing forward. I want to say something. This is progressing recovery and progressing the hope that people are searching for when they come to the doors of treatment. They come to the doors of treatment searching for hope, searching for something that will help them get off that block. And as we assist them, I've been doing this for a long time, and as we assist people in getting off of that block and moving toward that goal that we told them they could achieve, which was recovery, they start attaining things that we've identified as being part of recovery. And as they grab hold of it and start going, they continually hear the powerlessness that's identified with taking that next step. And then they continue to hear that. And as they continue to hear the same message over and over, it goes from the dependence on the drug to make them feel better because trauma is caught up in there. And then you have us providing services. I provided treatment for a long time. I'm doing peer recovery support mostly now. But and in providing treatment is about the interventions that people become dependent upon this intervention to help you move forward because we believe that this is going to work and we give it our all. And as they step into recovery, they get associated with the supportive services. And when we get connected with supportive services, we can find ourselves once again becoming dependent upon the meetings, becoming dependent upon the sponsors. And as we become dependent upon things because they will tell us that, yeah, you'll always be an addict and yeah, you'll always be processing or in the process of recovery. To a lot of my people that I've served, that sounds like hopelessness. So to provide the hope, so to identify that there is hope, I think that we should start changing the way we help them re-identify themselves as associated with the SAMHSA's working definition of recovery. Having an individual self-identify to live to their full potential. That's the hope that we have to help them find, because hope, if we say recovery comes from inside, then why are we telling people to do things outside of themselves, so much so that they never stop and take that in and look? Like, I get what Gilbert was saying, and I understand what you were saying in the slides about that self-awareness. And that's what that self-identification is about, being aware of who you are. Hey, in life, we have ups and downs. We can all attest to that. There are ups and downs in life. Isn't recovery about going through the ups and the downs? So recovery is about life. It's not something that we're sending somebody to go out and get. It's something we're trying to help people identify that's within themselves. And that's, I just wanted to make this statement.
Yeah, thank you, David. Yeah, I think just what you reminded me of is just when I started treatment and had very little hope, and there was a lot of people that lifted me up and had the hope for me that I didn't have for myself for a while until I found it again. Yeah, so thank you for sharing. All right, if no one's got anything else, Katie, do you got the next slide? All right, we just want to let you know 3 easy ways to refer a new patient to BrightView. So we have a call center, so it's open 24/7 that you can call the 833 number and speak with someone, and they will set you up for an appointment. We do have transportation, so we provide Lyft for the induction process. They'll let them know what to expect and what to bring with them on the first day. You can go online to brightviewhealth.com, or you can just walk in one of our facilities. So thank you everyone for joining us today.
Thank you for all your great questions. It's been great to spend some time with you this afternoon. Thank you.
Good job, everyone.
Happy holidays, everyone.
All right.
Yeah, happy holidays.